Imagine taking a medication every day that at once is saving your life, but at the same time threatens to take it away. A medication that requires you to go for regular blood tests to ensure its effectiveness and its safety. A medication that requires you to modify the types of foods that you eat, and requires you to be cautious with even simple things in life, like brushing your teeth. This is what a person taking Coumadin experiences. Coumadin and other blood thinners are powerful, effective medications that are used by persons with histories of heart attacks, strokes, blood clotting disorders, and often obesity. Taking the medication every day literally saves that person's life by preventing additional heart attacks, strokes, and the like. However, taking Coumadin and other blood thinners can be very challenging, modifying a person's quality of life. During this video, we will discuss your role as a caregiver and a medication aide when assisting your clients to take Coumadin. The use of Coumadin within your facility can require additional precautions that go beyond that used for many of the other routine medications that your clients take. Precautions such as additional documentation, monitoring of lab visits, and monitoring of general client well-being. With appropriate technique, adherence to policies and procedures, and good systems in place within your facility, you can ensure that your client uses their Coumadin as safely and effectively as possible. Coumadin and other blood thinners are part of a class of medications called anticoagulants. Although they are often referred to as blood thinners, these medications do not actually thin the blood. Instead, they decrease the blood's ability to clot. Decreased clotting keeps fewer harmful blood clots from forming and blocking essential blood vessels. These medications reduce the risk of heart attack, stroke, and blockages in arteries by preventing clots from forming and growing. However, blood thinners cannot break up blood clots that have already formed. A physician is likely to prescribe a blood thinner if an individual has had a heart valve replaced, or if they have conditions known as atrial fibrillation, which is an abnormal heart rhythm, phlebitis, which refers to inflammation of the blood vessels, congestive heart failure, history of heart attack or stroke, or in some cases, if the individual is obese. Coumadin is based on a chemical known as warfarin sodium. Warfarin causes its anti-clotting effect by impairing the production of certain blood-clotting proteins in the liver. These proteins, called cofactors, are necessary elements of a complex series of proteins which the body uses to form a clot. The proteins are the fundamental components of the clotting pathway, in which many other proteins participate. The specific action of warfarin is to block the production of factors 7, 9, 10, and 2 by the liver. Creation of these factors by the liver is normally controlled by vitamin K. This dietary vitamin is ingested with many different green vegetables and foods that we eat. In addition, vitamin K can be produced by bacteria that reside in your large intestines. As vitamin K is absorbed from the intestinal tract, it is absorbed by and stored in the liver. Subsequently, vitamin K is used during the production of these blood clotting factors. The administration of warfarin sodium blocks the action of vitamin K within the liver. All of the actions of Coumadin are due to the drug's inhibition of vitamin K. Thus, the ingestion or administration of vitamin K can reverse the effects of Coumadin. So put more simply, your liver produces proteins that are essential in clotting. And these proteins are produced in part by vitamin K. When a person takes Coumadin, it inhibits this action of vitamin K in the liver, thus inhibiting the production of proteins and ultimately reducing the production of clots in the person's blood vessels. Coumadin is certainly the most common anticoagulant used in our facilities. However, other examples of anticoagulants include Lovenox and heparin. As a caregiver or medication aide, we have 4 primary areas of responsibility when assisting a client to take Coumadin. Number 1 is dosing accuracy, ensuring that the medication is given according to the physician's instructions. Number 2 is assisting with lab tests. Persons taking Coumadin will go for frequent, typically monthly lab tests to monitor its effectiveness. Number 3 is to be cautious with the use of other potentially blood-thinning medications. And fourthly is to monitor for side effects. Let's start by talking about dosing accuracy. Because the effects of Coumadin can be so significant on the individual, the physician is typically adjusting or titrating the dose of the medication on a regular basis based on lab values. Because of this, the dosing of Coumadin is often much more complicated than other routine medications our clients take. We're normally used to clients taking medications once a day, twice a day, 3 times a day, at the same dose day in and day out. However, with Coumadin, the dose of the medication quite often varies from one day to the next. The challenge for us as a care provider is to ensure that we're giving the correct dose of the medication every day. The best tool you can rely on to ensure this is not your own memory, but good documentation and good systems in place within your facility. Number 1, be sure to check for updated physician's orders regularly. Now, the system you have within your facility may vary for how to do this, but we want to ensure that each time the client goes for a lab test, we check for updated orders upon their return. Secondly, ensure that your MAR, or your medication administration record, exactly matches the physician's orders. Be sure it clearly indicates if the dosing schedule is on a complicated every other day dose. Be cautious not to double dose a client when a new order comes in. If they are returning from a lab test with new physician orders, be sure to get a stop order for any previous dosages that they were taking. If you're ever unsure or unclear of how much medication a client should be taking, speak with your supervisor and speak with the client's physician immediately. As we've mentioned throughout this video, a client taking Coumadin will go for regular lab tests. This lab test is known as the INR-PT. INR stands for International Normalized Ratio, and PT refers to prothrombin time. These are both laboratory test values obtained from measurements of the time it takes to form a clot. Individuals at risk for developing blood clots take Coumadin to prolong the usual time it takes for a clot to form, resulting in a prolonged INR-PT. Doctors usually measure the INR-PT on a monthly basis to ensure it stays within the desired range. Should the INR-PT become too long, it means that that individual is at an increased risk for bleeding. However, should the INR-PT be too short, it means that that person is at risk for forming clots. It is based upon this lab value that the physician makes regular adjustments to the client's dosing schedule. To help maintain a stable INR-PT and to keep it within the recommended range, it is important to, number one, take the correct dose of Coumadin at the same time every day, again according to the physician's instructions. Secondly, keep the intake of vitamin K on a consistent basis from day to day, as we'll discuss later. And finally, have the INR-PT checked on a regular basis. Again, in the facility, we will defer to the physician's orders for how regularly the client will go for this lab test. Your responsibility as a care provider is not to interpret the lab values, but rather to ensure that the lab tests are completed according to the doctor's instructions. Work with the client, their family, the physician, and the lab itself to ensure that these tests are done on a regular basis. It may be your responsibility to contact the physician to obtain orders for lab tests each month. It may also be your responsibility to schedule the test with the lab, and finally to arrange for transportation. In some instances, such as in clients with dementia, we may also need to arrange for someone to go with the client and escort them to the test and back to the facility. It is also our responsibility to ensure good follow-through after the INR-PT is completed. As we discussed earlier, it is quite common for a physician to adjust the dose of the person's Coumadin based on this lab value each month. We will want to ensure that the lab reports the results directly to the physician so that we are not involved in interpretation. If someone else, such as a family member, has assisted a client to the lab, speak with that person upon their return to ensure that this information and any necessary physician orders are properly communicated. As with any medication, Coumadin and other anticoagulants can cause side effects. These side effects can range from the very mild, such as an upset stomach, to very severe effects, such as bleeding or shortness of breath. Our biggest concern when a client is taking an anticoagulant, such as Coumadin, is bleeding. We must monitor our client regularly for any signs of bleeding. For example, when brushing the teeth, are they bleeding excessively? Do they have excessive bruising? Or more seriously, are they coughing up blood? Do they have black or tarry stools, which is a sign of blood in the stool? Or do they appear lightheaded, dizzy, or fatigued? The primary reason a person taking Coumadin goes for regular blood tests is to monitor clotting time and to ensure that they are not at risk for these bleeding side effects. Other side effects of Coumadin can include upset stomach, diarrhea, loss of appetite, sore throat, hair loss, back pain, yellowing of the skin or eyes, which is jaundice, a sign that the person's liver function is being affected by Coumadin, headache, dizziness, sores in the mouth or bleeding gums, discoloring of toes or fingers, or other signs of bleeding as already mentioned. While some side effects may appear mild and others are blatantly serious, it is not our role to determine the severity of the effects. Anytime you see a potential side effect, report it immediately to the client's physician. Certainly, should any signs of bleeding be present, it may be necessary to call 911. Speak to your supervisor and refer to your facility policy and procedures to ensure that you take the correct steps should you notice any side effects in one of your clients. When someone is taking Coumadin, there is always the potential that there could be a drug interaction with other common medications. While again it is not your responsibility to memorize all of these potential drug interactions, it is your responsibility to monitor medication use in your clients. One example of a very dangerous potential drug interaction is with the very common drug aspirin. As we've already discussed, Coumadin works to delay clotting time in the body. As you may know, aspirin, in addition to being a pain reliever, can slow down the production of platelets, another important component of blood clots. So as you can see, if a person was to take Coumadin and aspirin together, there could be a very dangerous drug interaction in which the person is at a severely increased risk for bleeding. Speak with your client and speak with their family members to ensure that any medication they want to take is done under physician's instructions. If they feel they need a medication for headaches or other pain, speak to their physician to obtain a proper order for the safest medication rather than allowing the client to simply purchase some aspirin from their local grocery store. While aspirin is one common example, there are other potential drug interactions. So again, monitor your client's drug use and stay in close contact with their physician. Certain dietary adjustments may be necessary as well when taking Coumadin, the primary of which is a consistent intake of vitamin K. As discussed earlier, the primary action of Coumadin in the body is to block the action of vitamin K in forming blood clotting factors. To help Coumadin work effectively, it's important to keep vitamin K intake as consistent as possible. Sudden increases in vitamin K may decrease the effect of Coumadin. On the other hand, greatly lowering vitamin K intake could increase the effect of Coumadin. While you want to refer to physician's orders for specific dietary instructions, here are some general guidelines to follow. To help make it easier to keep intake of vitamin K consistent, limit the intake of foods that are considered to be high in vitamin K to no more than 1 serving per day. Limit the intake of foods moderately high in vitamin K to no more than 3 servings each day. Report any significant changes in diet or weight to the client's physician. Green leafy vegetables are among the best food sources of vitamin K. Here are some examples of foods that are high in vitamin K: spinach, kale, turnip greens, collard greens, Swiss chard, raw parsley, and mustard greens. Foods moderately high in vitamin K include Brussels sprouts, raw spinach, green leaf lettuce, raw broccoli, endive, and romaine lettuce. Iceberg lettuce, red cabbage, asparagus, and soybean oil are often reported as being high in vitamin K. However, they contain much smaller amounts than the foods already listed. While the intake of vitamin K is one of our primary dietary concerns when taking Coumadin, there are some other issues to be aware of. The first of which is alcohol. Alcohol intake can increase the effect of Coumadin. Speak to the client's physician. However, typically, alcohol should be avoided completely when taking Coumadin. Also of concern are dietary supplements and herbal medications. Many dietary supplements can alter the client's INR-PT. To date, much is still unknown about dietary supplements. Therefore, the safest policy for individuals taking Coumadin is to avoid all dietary supplements unless prescribed by their physician. This includes any vitamin or mineral supplements that list vitamin K on the label. The use of vitamin E supplements should also be taken with great caution when someone is taking Coumadin. Evidence suggests that vitamin E has blood thinning effects, and therefore it's best for those persons taking Coumadin to avoid vitamin E supplements unless prescribed by their physician. Watch to ensure that clients are not purchasing vitamin supplements over the counter and taking them on their own. Speak with your clients and their families and monitor their medication use. Coumadin and other blood thinners are powerful, effective medications that are used by persons with histories of heart attacks, strokes, blood clotting disorders, and often obesity. Taking the medication every day literally saves that person's life by preventing additional heart attacks, strokes, and the like. With appropriate technique, adherence to policies and procedures, and good systems in place within your facility, you can ensure that your client uses their Coumadin as safely and effectively as possible.